my role as a physician, it really energizes me to have this ability to sit with my patients and teach them how to live a healthy lifestyle, and then sit back and watch them transform their life. Child, I remember sitting at the Today Show with Willard Scott, and he would host the 100th Masterpiece birthday, and he would show these people that just knew how to live. They were vital, they were well preserved, and this intrigued me so much that I knew I wanted to go into medicine someday and figure out what is it that these people do that allowed them to get to this position in life. So I went on to medical school. I started with naturopathic training and then on to osteopathic school. And during my first few weeks of training, I started not to feel well. I went to see many, many doctors, and they said, this happens to all medical students. It's called psychosomatic. You're experiencing the symptoms that you're studying. So I went on. Well, my symptoms got worse. I was eventually diagnosed with stage 4 cancer, given 3 months to live, and I underwent 4 months of chemotherapy, a bone marrow transplant, and radiation, all while in school. But cancer for me was a teacher of life, and that's why I'm so passionate about why I'm here today. So what was so interesting, though, is during my treatment, particularly my transplant, I was in the room and I'd look out to the other rooms, because back then you're kind of the girl in the bubble, and I was there for a month, and everyone else looked really unwell. But I didn't think I looked unwell. I didn't see myself as sick. I didn't see myself really as that patient. I just knew I had to be there for my treatment, but I kept on living. And so I learned a lot along the way. I learned a lot from medical school, but I think I may have learned more as a patient. And the World Health Organization gets this. And in 1948, they said health is a state of complete physical, mental, and social well-being, not merely the absence of disease. So all too often, I have cancer patients come in and see me, and they get this. They're healthy. Sometimes I see patients who are high-risk patients who are more sick than any of my people with cancer. So no matter where you're at in your life, we really want to focus on the balance of health. So why is it that so much in medicine goes like this? The faucet is on, the drain is plugged, and the water is going all over the floor. So in medicine, we're really great at mopping up the floor, and we need to be. And you know what? In fact, without this, we wouldn't be curing cancer. This is our chemotherapy, our radiation, our surgery, our immunotherapy we heard about earlier today. We need these treatments. We shouldn't use natural therapies to replace that, because without that, we cannot ensure you a cure. But if we blend these therapies together, that's where it becomes magical. And in fact, we know that about 30% of the most common cancers are preventable. That's very, very important. That's important for those of us in the audience who haven't had cancer, but that's important for those of us that have, because we need to reduce the risk of recurrence as well as reduce the risk of secondary cancers. So at Mayo Clinic, we know the importance of this, and that is why we offer an integrative oncology program. The definition of integrative oncology is patient-centered, evidence-informed field of cancer care that utilizes mind and body approaches to helping cancer patients, natural products, and lifestyle modification, alongside, this is not replacing, but alongside conventional cancer care. The integrative oncology aims to optimize health, quality of life, as well as clinical outcomes across the cancer care continuum to empower our patients to be more well than they were even before their cancer. So I want to talk a little bit about science, and the rest of this is really going to be all about lifestyle, but I have to touch on this. So does anyone know what telomeres are? Okay, so telomeres are the caps on the ends of our DNA. They're very similar as to the caps on the ends of shoelaces. So if you walk all day and your shoelaces are underneath your shoe, what happens? That telomere, or in this case in the shoelace, is going to eventually fray, right? Well, we know if we don't take good care of our bodies, if we don't exercise, if we don't eat right, if we're stressed out, if we drink, if we smoke, the same thing's going to happen to our telomere. It's going to fray, it's going to shorten. In 2008, there was a study from Dean Ornish. This study was really interesting. It showed that when these telomeres shorten, we're at an increased risk of cancer. If we get cancer, it's going to progress, and we have an increased risk of death from cancer. So Dean Ornish took this information, and he took prostate cancer patients, and he initiated extreme lifestyle change. They did a plant-based diet. They exercised, as Dr. Rizzo said, 30 minutes a day. But the most important part of this study I feel, is what very few people do. They meditated or prayed for 60 minutes every day. And they had a 60-minute opportunity to go with a social group that did the very similar practice of praying and meditating together. What Dean Ornish showed in this study is not only did he halt the shortening of that telomere in people with cancer, it actually got longer. That means he was actually increasing their lifespan. So that's the science behind what we're going to talk about. But this is the problem. Our diet is sad, the standard American diet. No longer does our food even look like food. It doesn't come from farms, it comes from factories. And there's so many molecules in food nowadays, artificial sweeteners, colors, preservatives. We eat low fat, fat-free. Why? We just need to go back to the basics. So what is the world's most healthy diet? The Mediterranean diet, according to the U.S. News Report in 2018, again, the Mediterranean diet comes at the top of the list. The reason I talk about the Mediterranean diet is we know it's very pivotal when it comes to cancer, as well as reducing other diseases. The Mediterranean diet is again going to focus on that plant-based diet that Dr. Dean Ornish used with his telomere study, focusing on the value of vegetables, fruits, whole grains, legumes, and nuts. On the Orlando News this morning, as I was getting ready, there was a study on nuts and the importance of nuts in the prevention of cancer. And if you have 2 servings of nuts a week, you'll reduce your risk of cancer. We know this. Whole foods are important. Replacing butter with healthy fats like olive oil. And instead of using salt, maybe use herbs and spices. That'll be better for your blood pressure too. Limit red meat. Let's try not to eat red meat more than once a week. And let's increase our consumption of wild fatty fish. Getting fish in your diet at least 2 days a week. Enjoying your meal with family and friends. All too often now we're eating on the go, eating in our car, or eating with our phone texting. We need to get back to having the family meal at night. And then part of the Mediterranean diet is also exercising. I know a few of you are thinking, well, what about the wine in the Mediterranean diet? Well, we're going to talk about that because that's one part of the Mediterranean diet we do want to step back from. So if I don't put this slide in, I'm going to get a question on it. So what is my thought on the paleo diet and the ketogenic diet? I don't like restrictive diets. I think they're hard to comply with, and I think they're dangerous. Particularly the paleo diet, it eliminates grains and fruit. I think patients need fruit. There's many studies that show that fruit, even maybe more so than vegetables, reduces the cancer risk. And then we look at the ketogenic diet, where the ketogenic diet is eliminating many of the same things, where the ketogenic diet is actually eliminating all fruits. The paleo diet will let you have some fruits like berries, but it is eliminating sweet fruits as well. So my problem is these diets are eliminating important foods. Both of these diets eliminate grains. We know that grains and the fiber from grains can reduce cancer. So let food be thy medicine, let medicine be thy food. Hippocrates, the first doctor 3,500 years ago, said this. He knew it way back then, but in our translation of sciences, we've forgotten a lot. We know that food has phytonutrients. These phytonutrients are medicinal chemicals in our food that can help to fight cancer. Here's our first group we're going to talk about, my favorite, cruciferous vegetables. How many of you have had cruciferous vegetables in the last 24 hours? Broccoli, kale, Brussels sprouts. Good. So we know that cruciferous vegetables have lots of vitamins, minerals, and fiber. The phytonutrient in our cruciferous vegetables is glucosinolates. When you chew the cruciferous vegetables, it's going to release these phytochemicals called indole-3-carbinol and sulforaphane. These are extremely bioactive chemicals that help us in the fight against cancer. They have strong antioxidants, anti-inflammatory, and detoxification of harmful substances such as carcinogens. High dietary intake of these cruciferous vegetables is associated with a lower risk of breast, ovarian, endometrial, prostate, stomach, pancreas, colon, lung, and liver cancer. So eat your cruciferous vegetables daily. Carotenoids. There's over 40 to 50 carotenoids in your diet. Carotenoids give fruits and vegetables that bright orange and yellow color, and even the green color, such as kale, that's part of a carotenoid. Some of the most studied carotenoids we know of are alpha-carotene, beta-carotene, lutein, and lycopene. Again, like the cruciferous vegetables, very strong antioxidant values. We know that in dietary studies showing individuals that have higher carotenoid intake, there's a decreased risk of cancer. Oops, sorry. So I had a question even before the presentation today because they saw this X through beta carotene. We don't want beta carotene as supplements. We're talking about getting these nutrients from your food. When you get beta carotene through a supplement, when we started off, we talked about how there's 40 to 50 carotenoids in your diet. So if you take only one beta carotene, you displace the body's ability to absorb the others, and that can be very harmful. There's been studies that have showed it can actually increase the risk of cancer. In men who are smokers or have recently smoked, it increases the risk of lung cancer. We also know that beta carotene supplementation has shown an increased risk of the most aggressive prostate cancers. And additionally, clinical reviews show that beta carotene actually increases the risk of cardiovascular mortality. Blueberries. We know berries should be part of your diet every day. Raspberries, strawberries, strong antioxidant properties, and the phytochemicals are anthocyanins and pterostilbene. We know that these pigments are what impart this anti-cancer value. In lab and animal studies, we show that these particular phytonutrients stop the growth of precancerous cells, increase cancer cell death, and inhibit the growth of blood vessels that tumors rely on to grow. So it's very important to include this food group in your diet daily. Mushrooms. Mushrooms are a superfood, true medicinal value that are showing significant value and properties in the laboratory studies we're now doing. We know that these mushrooms, particularly Asian mushrooms, reishi, shiitake, and maitake, enhance immune response in cancer patients. We're seeing these particular bioactive substances actually augment the effects of some chemotherapies, and they may enhance the effects of radiation therapy. There has been a few documented cases of some increased liver enzymes, so you would want to be careful with doing too high of a dose if you were taking this in an extract form. But again, going back to the diet, dietary sources of mushrooms are very, very good for you, so enjoy them in your diet and your cuisines. One thing I do encourage my patients to do with mushrooms is to always cook mushrooms. There is a substance that can be found on mushrooms. It's a relative of a hydrazine, which is a carcinogenic chemical. When you heat this, it's heat labile, so it dies. So cooking mushrooms is important. Does anyone know what this is? You probably do because it's on your coffees there. Turmeric. Turmeric is a known spice we use in cooking, and the active chemical in turmeric is curcumin. This is the most common supplement I see my patients using nowadays because it's really been advertised in social media and in different health magazines. Laboratory and animal studies certainly are extremely promising to show that it has many anti-cancer effects, as you can see listed here. We also see that, like the mushrooms, the curcuminoid products may enhance the effects of some chemotherapies and radiation. However, there's a big concern we have with curcuminoid use during chemotherapy. And the problem is there are some chemotherapies that curcumin can actually deactivate, such as cyclophosphamide. And there are others because it goes through a very important pathway that many of our drugs utilize for metabolism. So this is a substance when I am working with my cancer patients that I ask them to stop during active treatment. In survivorship, I think this is a very valuable supplement. I do think dietary sources are also to be encouraged, but it is hard to get enough in your diet from absorption. So bottom line take-home message is don't use during chemotherapy unless your oncologist says it's okay. In survivorship, it may be something that's valuable, particularly if you have high risk of pancreatic cancer because of genetic mutations. We did do a study at Mayo Clinic where we saw some modulation of the pancreatic cancer tumor marker. Green tea. I think green tea is a very important part of our diets. Again, with green tea, I really tend to encourage the use of green tea in survivorship. I am a little bit shy during chemotherapy because green tea does have very bioactive chemicals. If you're on Velcade, which is used for some of our myelomas and lymphomas, you do not want to drink green tea. Same thing with Coumadin. Green tea can can generally antagonize Coumadin. So again, food is medicine, so you have to be careful with some of these agents not to overdo it if you're on certain therapies. So be sure to talk to your doctors. But in survivorship, I do encourage my breast cancer patients to enjoy green tea. If they don't like it, I don't push them into it, but if they enjoy it, I want them to enjoy 3 to 5 cups a day. The studies at this point are really in animal research. The human studies have been inconsistent today. They're actually very good for you. And we know that we want you to get 30 to 40 grams of fiber a day. And grains are a great source of fiber. Grains are also a great source of selenium, which has a lot of anti-cancer properties. And we know that selenium can help to reduce radiation toxicity. So I want my patients to get whole grains. The fiber in the whole grains is very good for you. Fish. We talked about this early on when we mentioned the Mediterranean diet. Wild fish is a very important part of your diet. We know that individuals with optimal levels of omega-3 fatty acids have been shown to reduce the risk of colon and breast cancer and reduce the risk of renal cell carcinoma recurrence. We've also seen that fish oil improves the chemotherapy effects and overall survival, as well as maintains muscle mass in patients with non-small cell lung carcinoma. There has been a study that showed that in prostate cancer patients with the highest omega-3 levels, that they had a more aggressive form of prostate cancer. So it goes back to everything in moderation. No one should be doing what's called orthomolecular or super high doses of any one thing. Receive your fish in your diet 2 to 3 times a week. I do see the benefit of fish oil supplementation for some patients. You want to be cautious with fish oil if you're on blood thinners, particularly if you're having more than 4,000 milligrams of fish oil a day. When looking for a fish oil supplement, if your physician says it's good for you to be on a fish oil supplement, you want a combined EPA to DHA supplement that's a high quality supplement. Flaxseed oil is another way to get omega-3s. This would be your primary vegetarian source of omega-3s, also very good for you. So many patients ask me, should I eat organic? And I say, if you can, it's going to allow you to not be exposed to over 400 pesticides that are in our traditional produce. There's no research to support or validate that there is more nutritional value in organic foods. But the thought is maybe there is. The research hasn't come that way yet, but if these plants have enough strength to live in the environment against the elements, then what the thought is that their phytonutrients are a little stronger, and that's in fact what's fighting off the organisms that aren't eating those organic produce. So if you can buy organic produce, it may be safer because you're avoiding some of these pesticides. The environmental working group does not have the 2018 list out as of yet, but the 2017 list is attached here. The Dirty Dozen list are the 12 vegetables and fruits with the highest pesticide count that if you have the opportunity to buy them organic, maybe are the ones you should focus on. Versus the Clean 15 list, those are the ones that really you probably don't need to buy organic because the pesticide count seems to be relatively low anyways. Here is a website for you. There's an app you can download on your phone, and you can pull it up when you're at the grocery store. So red meat, processed meat. Processed meat does cause cancer. That's a strong word, but it does. The research tells us this. And red meat probably causes cancer. So this is why we want to limit the consumption of red meat. The World Health Organization says that eating 50 grams of processed meat a day, such as 2 slices of bacon, increases the risk of colorectal cancer by 18%. What about grilling? The majority of everyone here is probably from Florida, so we're getting into that season where we grill out every night. So grilling actually increases these chemicals, polycyclic aromatic hydrocarbons and heterocyclic amines. What happens is when you cook meat on very high temperatures, the hemoglobin in the meat breaks down into these products, which are carcinogenic. So we want to be very careful. We know that these particular compounds increase the risk of breast, colon, prostate, pancreatic, stomach cancers. And we know that if the food is cooked to the point that it's very black and charred, it increases its risk 3 to 5 times higher. So as you heard Dr. Jane comment on the fact that sugar is what drives our cancer molecules, and that's why they can pick up these cells when they do this special molecular imaging, sugar, maybe it does increase our cancer risk. How many pounds of sugar do you think the average American eats in a day? And this is refined sugar, not sugar from fruit. How many people think 10 pounds a year? How many people think 50 pounds a year? How many people think 170 pounds a year? It's 170 pounds a year the average American consumes sugar. So that's a problem because sugar has been shown to increase the risk of prostate, colorectal, and pancreatic cancers. And one study showed that the consumption of these high sugar loads increased prostate cancer by 26%, rectal cancer 44%, and pancreatic cancer by 41%. So we need to look at our labels, and if the label under the ingredients says sugar, it's probably not the best thing. Sugar comes in many disguises, so be critical when you read that label. Now, if you read a label and it has the fact that it has dates and prunes, that may be a little more natural. When you look under the label, you may see that 2 bars have exactly the same amount of sugar grams, but if the 1 bar that you're looking at has all natural substances going into it, like the whole fruit, that's going to be okay. What we don't want is for patients to have sugar, cane juice, fructose corn syrup, etc. So I do have to mention the slide about the healthy gut microbiome. I think this is an important part of our overall wellness. We know that we can get a healthier microbiome in the gut from prebiotics, meaning eating lots of fiber that we talked about earlier from vegetables, onions, garlic, asparagus, leeks, and yams. From probiotics, foods like yogurt, kefir, and lacto-fermented products like sauerkraut and kimchi. And flavonoids from those brightly colored vegetables and fruits we talked earlier. So what about probiotic supplementation? I think it's probably good for a lot of patients. If you're on active chemotherapy and your cell lines are becoming at the point that you're neutropenic, speak with your oncologist. Some oncologists are not comfortable with their patients being on probiotics during that time. But otherwise, I think it's something to consider, particularly if you are using antibiotics on a rotating basis or more frequently than others. With probiotic supplementation, what I recommend is rotating the brand so you get a different strain of probiotic maybe every month, okay? So dietary supplements, really, I don't encourage dietary supplements as a whole. I really want my patients to get their vitamins and nutrients from their diet. I do say that there is one limit to that, and that would be vitamin D. We know that vitamin D in cancer research seems to be important, but you need to have your doctor check your vitamin D level. So the serum 25 hydroxy vitamin D should be in the range of 35 to 50. 50 seems to be about the sweet spot. So ask your doctor, if you haven't had your vitamin D level checked yet, have that level checked. If you're less than this number, perhaps vitamin D supplementation is right for you. We want to be very careful of dietary supplements. I have people comment all the time bringing in these special labels, these special boxes, bags of supplements because they think that's going to fight and ward off cancer, and that's generally not the case. I get very concerned about products that have multiple ingredients in particular. And please know that the majority of dietary supplements do or can have interactions with your conventional chemotherapy and current cancer treatments. Alcohol, do you drink it? Well, let's rethink it, because we know that alcohol can cause 7 cancers. We know that 5.5% of all new cancer occurrences and 5.8% of all cancer deaths are because of alcohol directly. So for men, you should definitely not drink more than 2 alcoholic beverages a day, and for women, less than 1 a day. The problem is the serving size, and the majority of my women are enjoying wine daily now. It's an epidemic I'm dealing with, and so some of them get a little bit frustrated when we talk about this subject because they don't want to give it up. It's a social part of their day and their enjoyment and pleasure. But if it's wine, it's less than 5 ounces a day, which is a very small pour. If it's liquor, it's less than 1.5 ounces, and if it's beer, it's a normal size beer. For men, you are allowed to have double that amount. I had one woman almost get hostile with me at one presentation. She said I was being sexist, and I said it's actually how you metabolize the alcohol is differently for men and women within the alcohol dehydrogenase enzyme. So Dr. Rizzo talked about this. Sitting for many hours a day is an independent risk factor for cancers. We know in particular when individuals sit for longer than 2 hours for any one interval, it definitely has been shown in research to increase the risk of endometrial and colon cancer. 31.5% of cancer survivors haven't exercised in the past 30 days. That's concerning. I won't go into too much detail here because Dr. Rizzo went into such beautiful detail about the benefits of exercise, but we know that exercise is very important for cancer patients, survivors, and loved ones. Everyone should exercise. 30 minutes a day, at least 6 days a week. Some cancers require more. Breast cancer, you want to have at least 3 hours of exercise a week. Colon cancer, 6 hours a week. These particular cancers do require that increased metabolic equivalent for the true risk reduction. What I see in my patients is that when we give them the true recommendation, they generally are more motivated to meet that goal, especially when they see the robust effects of such. Sleep is a third pillar of health. We've talked about nutrition, we've talked about exercise, so I can't forget about sleep. Sleep is ever so important. The goal is about 8 hours a day. If you snore, your doctor should probably check you for sleep apnea. Sleep hygiene is very important. Sleeping in a cool, dark room without the TV on. Chamomile tea can be a really relaxing ritual before you go to bed. And I like melatonin if my patients are having issues with cancer-associated insomnia. It is something that I have implemented, but again, you would want to speak to your physician. 47% of our waking hours are like this. We're so distracted, we don't even hear the important conversations anymore. But then we add this, and it disturbs this process even more. So how do we get back to this? Because really, we're fighting through cancer to live, to be with our loved ones. But during the journey, if we phase them out and we don't experience these special moments, then that's a problem. So there's many mindfulness experts that are around, and this is a new buzzword. Every magazine once a month has an article about mindfulness. There's everything from, mindfulness exercises to mindful eating to mindful walking. So pretty much you've probably become experts in this on your own just from your resourcefulness. Jon Kabat-Zinn was really the mindfulness-based stress reduction leader here in the United States. And you'll see here that he feels mindfulness means paying attention on purpose and non-judgmentally to be in the present moment. We see here that Thich Nhat Hanh, Peace Prize winner, we see that mindfulness for him is keeping one's consciousness alive again to the present reality. So it's the same thing, same theme time and time again. Andy Pudencombe, he is founder of Headspace. He found Headspace over 10 years ago, and several years ago, after he was founder of Headspace, he was diagnosed with testicular cancer, but he too is very active in the mindfulness movement. Dr. Amit Sood wrote this lovely book called Stress Free. This book taps into the importance of mindfulness-based living. So let's just think back 24 hours for each of you individually. How many of us felt extremely distracted in the last 24 hours? Yeah, it's common, right? How many of us, let's just go to C, felt that you were able to focus and you didn't get easily distracted, so you did pretty good. Did anyone feel consistently undistracted, kind, non-judgmental presence? That's the goal. So assess where you are now and let's see if we can make some changes. We know that there's science behind this, and we know that there's science that can benefit cancer patients when it comes to mindfulness-based stress reduction. For all of our newly diagnosed breast cancer patients, we offer them mindfulness training at the time of their diagnosis. We see this as very, very important. We know that meditation can change the brain in places that are important for focus, empathy, and compassion. This study here implemented functional MRI. These patients did a functional MRI before and after the study. The study included 40 minutes of meditation daily, and we see in these areas that show this enhancement, which you're able to learn all about radiology from some of our previous lectures, that this is where the brain is more active as a result of this meditation. So this is a learned skill that could be easily transferred to ordinary activities, because a lot of you are probably thinking, well, I don't have 40 minutes a day, how am I going to do this? But you do have time when you're walking, when you're sitting, when you're eating, when you're breathing, when you're answering the phone, or even preparing for a meeting. And it can help you to reset and really be present, enjoy the day, and even be more productive in what you're doing. What about movement meditation? Things such as yoga, tai chi, qigong, or progressive relaxation. The Society of Integrative Oncology strongly recommends these mind-body attempts to improve well-being. We know that for cancer patients, it improves depression, anxiety, chronic pain, and overall quality of life. There was a recent study with lymphoma patients that showed an improved sleep quality. So we know that these Movements that include breathing exercises and meditation are very, very valuable. Acupuncture is a service we offer to our patients at Mayo Clinic. Acupuncture involves the use of very small, thin needles, like a monofilament, almost as thin as a hair. It stimulates different points on the body that are known to stimulate the flow of internal energy known as qi. This stimulates the body's natural ability to heal. We know that through evidence-based research, dry mouth from radiation, migraine, nerve pain from chemotherapy, fatigue, hot flashes and night sweats, overall well-being, swelling of the arm or extremity following removal of lymph nodes called lymphedema, anxiety, depression, and even help with tobacco and alcohol cessation. So how does acupuncture really work, or is this just hocus pocus? Well, here's one of the very common points we use in our acupuncture at Mayo Clinic for our breast cancer patients. This is a stomach 36 point. It's in the anterior leg on the tibia. And what we see here at the bottom is your bottom left. I'm sorry, I had to think I guess it's in my bottom left too because I'm looking, but I'm thinking the opposite. So the bottom left side of the slide here, what we're looking at is these areas of activation in red and these areas of deactivation in blue. So we can see it's actually doing different things at different places in the brain. And we know this stomach 36 point stimulates energy, immunity, and helps digestive disorders. We have seen tremendous value of decreasing adverse effects to therapy with the use of acupuncture in our integrative medicine program. Acupressure is something patients can do if they do not have access to an acupuncturist. There are some programs that offer trained therapists to do this, but this is also something patients can learn. It's nothing you can hurt yourself in doing. So there is a point called the P6 point, and it comes just 2 fingertips down in the middle of your wrist. And this is an important point for chemotherapy-associated nausea and vomiting, seasickness, or if you just get traveler's nausea when you're flying. They sell these special bands you can find online or even at Walgreens. And basically, acupressure is a way of using some of those same acupoints that they use for acupuncture, but without the needle. We saw a 6-week study of self-administered patients doing it themselves, relaxing acupuncture, improve fatigue, sleep quality, and overall quality of life compared to usual patients in breast cancer. And then lastly is medical massage. This is another therapy we offer to our patients to help with overall relaxation, reduction in anxiety and depression. There are many studies showing the benefits of medical massage. We also see the reduction in cancer-related pain. We've been doing research in our inpatient setting where we implement massage therapy to patients in the hospital. We're seeing a 60% reduction in pain scores compared to the use of improved sense of well-being, improved energy, enhanced immune function. We see in cancer patients we're actually able to stimulate their immune system with massage, myofascial release, and again, improvement of lymphedema like we saw in acupuncture. So in closing, let food be your medicine and medicine be your food. Exercise daily, savor the moment, be present, and feel fully alive. Thank you very much.